Welcome back. Only about 41,000 people in Colorado have received their second COVID-19 vaccine. And one of those familiar faces is Mile High Mornings. Joining us now is Dr. Comilla Sasson. Good morning, Dr. Sasson. Thanks so much for joining us.
Good morning.
Well, first, before we talk about the vaccine, can you give us an update on what your day-to-day work life looks like right now?
I have actually been on the road for the last 10 months working with COVID patients in New York, through Indian Health Services, so North Dakota, South Dakota, Montana, and then parts of Texas as well. And then, of course, taking care of patients here in Colorado. So it's been busy, to say the least.
You've been busy, and I remember watching you beginning of the pandemic when you gave an update on how things were and how difficult things were. And you got your shot, your first shot back in December. You tweeted that it was a huge relief. Now, what other feelings did you feel in that moment?
I think it just feels like there's finally a light at the end of the tunnel. Especially as a healthcare worker, it's been such a long 10 months. Just thinking, gosh, when is this going to be over? Are we ever going to get back to life as usual? And getting that first vaccine, there's a real sense of relief there. And then I just got my second dose on Sunday. So a few more weeks, I should say, and I'll be, get my 95% immunity and just feeling a lot safer about going to work. And then also just being around my family and my friends again.
I love that. I love also that you said it was feeling hope for the first time in a long time. Boy, is that true. So you said on Sunday you got your second dose. What vaccine did you get? And how was your experience? Do you have any side effects?
No, I got the Pfizer vaccine, so got my first dose, had a little bit of soreness just in my left arm, just felt like I'd been maybe working out a little bit, and then that was it. And then got my last dose on Sunday and really no symptoms at all. I think everyone's got a lot of questions about how quickly the vaccine came out. Is it going to be effective? I'm not sure if I trust it. I'll tell you, as a doctor who's been doing this for 17 years, this is the most important thing anybody can do. If you have the ability to get the vaccine, get it, because it's going to make a huge impact, not only on you, but also everybody else around you as well.
Absolutely. I will be getting mine too when it's ready. And I do want to ask you about your work environment. Has that changed now that many hospital workers have been vaccinated?
At the end of the day, we still are going to do all of the same precautions that we've always done. So even when I go out to the grocery store, I'm still going to wear my mask. I'm going to socially distance. I'm going to wash my hands. Because again, we have to wait until we get that herd immunity. So that means everybody in the community has to be able to get that vaccine. So for now, it's still business as usual. So I still wear all my personal protective equipment, my PPE when I'm doing, my work with COVID patients. But again, there's a light at the end of the tunnel. There's hope. We're going to get through this. And I feel just really, really thankful that everyone has come together globally to make this vaccine not just happen, but work, which is amazing.
Absolutely. Well, Dr. Sasson, so nice to see you again. Thanks for coming on and sharing your experience.
Thanks.